Hello, I'm Julie Thompson. Welcome to the Kingston Board of Health candidate interview. I want to take a moment to thank our candidate for participating in this interview and collaborating with PAC TV to bring this informational programming to residents and voters this election season. Let me explain the format. Today, Norman Harbinson Jr. will be interviewed. Norm will have 2 minutes to introduce himself, speak about his background, qualifications, and why he's running for office. I will then ask a series of questions related to local issues. Norm will be hearing the questions for the first time. He will have 2 minutes to answer the questions. After the questions, Norm will have 2 minutes for closing remarks. The 2-minute time frame will be shown on the screen for him to see. Let's get started with the opening statement. Norm, you have 2 minutes. Go ahead.
Well, first of all, thank you very much, and PAC TV, for providing us a venue that we can talk with the COVID problems. I'm Norman Harbinson. I lived in Kingston for about 25 years now, retired from the U.S. military. I have decided to run for the Board of Health because I've had some issues with the hired employees myself, and a lot of the businesses are complaining about the bullying tactics that they are using and the excessive fines. I did a little bit of an investigation and discovered lots of inconsistencies with the state mandates. And I feel that our hired employees are running the Board of Health, and the Board of Health are not running the hired employees. With my background in the military, I have an ability to take charge and ask for documentation and research exactly what should be happening. And that's the basic summation.
Okay, thank you. And now we're going to go on to question number 1. What is your vision for this position, and how will you communicate that to the board? You have 2 minutes.
My vision for me is to become, adult leadership and supervision. Our hired employees are not doing the job that they should be doing, as I said earlier, overbearing, and they don't have anyone watching them. I am not that familiar with health issues. However, in the short time I've been studying, I've actually been reading the regulations and found many inconsistencies. So I would act more of a check and balance when they do something, saying, hey, that's exactly right, or no, what about this?
Okay, thank you. And now we're going to go to question number 2. What would be your top priorities for the next 3 years for the Board of Health? You have 2 minutes.
To be able to communicate with the town, be helpful, not dictatorial as you must wear your mask, you've got to do this, you've got to do that, explain why, provide education. Education and a good set of communications between the board, the hired employees, and the public. Things should run a lot smoother and not reinvent the wheel. We have the CDC, we have the state providing us guidance and information. We just need to follow that, not try to come up with our own 18-point plan.
Okay, and now we're going to go on to question 3. As the state's reopening plans move forward, what are your concerns and how would you address them? You have 2 minutes.
How would I address them in my concerns? Well, my personal concerns and professional concerns would actually be 2 different things. We need to reopen. Businesses are suffering, they're going out of business. I did own a business myself. I no longer have it because my customers couldn't hire me anymore because they were out of business. Moving forward, follow their guidance, open up as soon as we can, and use common sense. Wear the mask above the nose. Go into many places and people have them down here. It just doesn't work that way.
Okay. And we're going to go to your closing remarks. You will have 2 minutes to close up on anything or say anything that we didn't talk about yet so far. Go right ahead.
Oh, that was pretty fast. My main concern is that the Board of Health has nobody there that asks questions. Why? An example, our hired people went into a business and wrote $1,000 fine for people not wearing masks. The state says it's a $300 fine. Where did the extra money come from? as I said, nobody supervising them or asking the hard questions. As a member of the board, not being really up on everything, I'm going to have to research and read, and I should know the most correct and most current information. That was one thing in the military as a supervisor. You could get one job today and they want you to take over another project, and you go, and I can't even spell that project. You have to study and read. And military finds putting new blood in helps, because you start asking questions and holding people accountable. So, in summation, as a member of the Board of Health, I would hold people accountable to what they're doing and ask the hard questions. Why are we doing that? Can't we be educating instead of and laying down such heavy fines on businesses? They need to stay in business, and fines are not helping them stay in business.
Okay, thank you so much. Thank you for participating in this interview. We wish you the best of luck throughout your campaign and in the election. For our viewers, thank you for joining us. If you're interested in watching replays of this interview, please visit our website, pactv.org/elections, for replay times and online viewing options, including PAC TV's on-demand and streaming service, PAC TV Prime. And please make your choices heard by voting in the town election on Saturday, April 24th. Thank you and good day.